Hi, Steve from One to Physiotherapy and Osteopathy. And we see a number of patients now coming through our upper limb clinic with wrist and hand injuries. Now, when we rule out traumatic injuries such as wrist or hand fractures and tendon ruptures, which will typically end up in A&E, there's probably three common problems that we see here at the clinic. Now, the first one is carpal tunnel syndrome. Now, this is a compression of your median nerve in the carpal tunnel in your wrist here, which is made up of the carpal bones in the wrist and a ligament that sits over the top of the nerve. And through that carpal tunnel also run some tendons to your thumb and fingers. Now, if you do a job that involves a lot of repetitive gripping or typing, you can make the muscles and also the tendons in your wrist a little bit bigger. Now, that will crowd the space in that carpal tunnel and it can start to then just squash onto the median nerve a little bit. Now, the symptoms that you'll get will be some pins and needles or numbness into your thumb, index, middle and half of the ring finger. Now, symptoms can be intermittent, that come and go, or they can be more persistent. And there's a number of tests that we can use, such as compression over the carpal tunnel, Phelan's test, different nerve stretching tests that can help us come up with this diagnosis. And we can also ultrasound scan the wrist and see if the nerve looks compressed. Now, if we've got a diagnosis of carpal tunnel syndrome, then there's a few things that we can do. If it's a persistent tingling or numbness in the hand, then you may well need to see a surgeon for a carpal tunnel release. However, if the symptoms are intermittent, we could perhaps try soft tissue work, nerve mobilizations, splints at night, and see if those things help to calm the symptoms down. If they're not resolving, sometimes it will respond quite nicely to an ultrasound guided steroid injection around the nerve to try and settle the symptoms down.